So yes, there's a test called anti-Mullerian hormone, also known as Mullerian inhibitory substance or Mullerian inhibitory hormone.
Okay.
And what it is it's secreted, so it's put into your blood system. It comes from the potential eggs in your ovaries, the dormant eggs. So we are also, all the women, not the men. Men have testicles, no eggs in them. But the eggs sitting in our ovaries dormant are secreting this anti-Mullerian hormone.
Okay.
And when you're younger, because you have more eggs in your baskets, your AMH is normally higher. When you're older or nearing menopause, your AMH is really low. And then after menopause, your AMH is not determinable in your blood.
Okay. So they test it to see how much of that hormone you have.
So there's been a little extra hype to it such that people are extrapolating from, well, my number is pretty good, so my eggs must be fine.
Oh.
That's wrong.
Okay.
Because quantity doesn't equal quality of eggs.
Right.
And so the way fertility specialists do it is we use it as a test that we use in conjunction with other things. Okay. But it does allow you to compare yourself to other women of your age and stage. So we're kind of same age-ish. Mm-hmm. So our AMHs should be between a certain range. Okay. If you are below that range, you kind of worry that, okay, well, my number of eggs should be around here, but it's lower. So that's why she said, you know, my ovaries, I'm 46, but I'm really 32, and my vagina is 97. Right. So it's true. So it'll tell you, okay, well, my AMH should be in this range. If I look at my AMH, I'm looking more like 43 years old.
Right.
But you can't extrapolate menopause from it. And it can't tell you, well, you're good to go, you can wait if your AMH is okay. Other things need to be looked at to determine quality of eggs.
I want to know what those other things are then, okay. Because as we know, there are so many women that are waiting until a little bit later on to have kids. Yeah. And then, you know, there's sort of this myth that we can because, you know, Mariah Carey's pushing out twins and
I don't know, she had help. People don't know,
I know,
right?
They don't talk about it, but
yeah.
every single person in Hollywood is like 40-something and pushing out babies like it's
because
the easiest thing in the world.
Me, though, right?
Because of people like you who are helping them.
Who are helping them, we're assisting. And sometimes they have people like me using other people who help them. So sometimes it's donor eggs and they don't know that. So eggs have a kind of a use them or lose them policy. And they were right. There was a study that came out in Edinburgh that talked about the quantity of eggs that you have at 30. And so by the time you've reached 30, you've depleted your ovarian reserve of 90% of its eggs. That's true. But it's 90% of a total of somewhere between 1 million and 400,000. So if at age 30 you have about 40,000 eggs left, that's not so bad. Yeah. And generally around that age, the quality of them is still pretty good.
Okay.
But when you reach 40-ish,
yes,
you have only 3% of your eggs left, which is not so good. But also what's not so good is the quality of them at that stage. So tests that we use to determine the quality of them are a day 3 FSH. So much as the AMH that we talked about before can be done at any point in the cycle because the overall quantity of eggs doesn't change over the cycle. Your day 3 FSH, follicle stimulating hormone, should be really low at the beginning of your cycle. So your brain should only have to secrete a little bit of this hormone to kickstart the process of choosing an egg that may be destined for fertilization. But if your brain has to spit out a lot of that hormone, so if your FSH is high, that's an indication that your ovaries are not responding the way they should. Okay. So imagine turning the engine of your car. You turn it, spark goes, your engine turns over. If you're turning the key in the engine and you get the roar, your engine's having trouble. So that's how we kind of imagine how you can figure out quality. There are other ways. You can look at the ovarian volume. We've talked about this before. Your ovaries start out like plums. And eventually end up like prunes. Not quite raisins, it's not that dismal. So they decrease in volume over your reproductive lifespan.
Right.
So those are things that we look at. The FSH, your ovarian volume, and then something called an antral follicle count. So eggs go through different stages in their development, and part of the early developing ones that have the potential of growing to the final point in your cycle where it gets ovulated, those are antral follicles. We can count those at the beginning of a cycle with an ultrasound. So we put those together as kind of a composite picture of your egg quality, and therefore we then look at how easily it should be for you to get pregnant or not.
And then you figure out a plan of action. So you would do all four. You would do all 4 of those tests.
I do all of those tests on my patients that come in with difficulty getting pregnant.
And you can only get those tests done if you go to a fertility specialist like yourself.
Some of them can be done by a generalist or a family doctor, but the AMH test is a special test. OHIP doesn't cover it. It has to be sent out. Your doctor has to know of a reputable lab that it goes to. And then also there are different units of measure. So if you find out in one place that it's something, you can't go on the internet and not know what the unit of measure is and say, oh my God, I'm not on the right right range because there are different ranges for different units of measure.
Okay. So yeah, you need a professional like Dr. Marjorie Dixon to help you out. Okay, so is there anything that you can do outside of what we've been talking about with the biology to increase your chances of fertility?
Yes, you can. So you're kind of doomed to your genetics and whatever your predetermined eggs are for whatever stage of your life. And it's important to talk to your mother and your sisters because those are good gauges of kind of how you will behave reproductive-wise. Okay. But other things you can do, and this is where Bryce, my TV husband, will tell you that you have to really work at being healthful. So, you know, decreasing your weight, decreasing your BMI is very important. Cutting out certain things, maximizing vitamins, so you have to be up to date with your folic acid, vitamin D supplementation, and then working with allopathic medicine as well. Naturopaths sometimes use acupuncture to help for people's fertility, so we call it fertility optimization. So, you know, much as we talk about healthfulness, it's important, but we haven't changed the evolution of the ovary, and that's a drive home point. So they were, you know, worried about their ovaries. They were right. We need to start worrying about our ovaries when we're like 28, 29, 30. Because
you're supposed to have your kids when you're a teenager.
Like
apparently.
when you're 19, can you imagine? I would have dropped my baby.
I was crazy.
I know, right? But so much as we have evolved and we have careers and education and we don't meet our partners till later in our lives, that it all makes sense. But you know, it takes millions of years for evolution to happen. Our ovaries know. We're supposed to be grandmas now.
Oh, Marjorie, bite your tongue.